Finally, we get to the bottom of some old wives' tales. For instance, is there any truth to the 5-second rule?
I really want to know about that one. Or how about starve a cold, feed a fever? We wanted answers, so we asked Dr. Rupy.
Something a little different for today's edition of Ask Dr. Rupy. We're going to cover some medical myths. Okay, let's get started. Let's bust some of these. Rupy, what are some of the common ones that we hear?
So some of the common ones that I heard even growing up myself was that cold weather causes a cold, or wet hair will cause a cold. So what do you think? Is that true or not?
You know, my mom definitely always used to tell me that, but I'm thinking it's false.
It is, yes, you're totally right. So when it comes to the actual cold, virus or bacteria is what causes the upper respiratory tract infection. The cold weather can predispose you to catching a cold. This happens because your nasal passages dry out or the air is dry and doesn't have humidity. So those virus particles can pass through the air a lot quicker. Also, in the colder weather, we tend to be indoors, we tend to congregate a little bit, and that can also predispose to catching a cold. But the cold weather itself, it is absolutely a myth. It does not cause the cold.
Okay, I'll tell that to my mom. She always tells me I have to wear a hat. But speaking of hats, what about our thinking cap? Something says we only use about 10% of our brains.
Yeah, so that's another thing that I've heard commonly as well, that we only use 10% of our brains, which is kind of intriguing because what's going on with the other 90%? This is actually false. So we have PET scans and MRIs that show us that we have quite a bit of brain activity in 100% of our brains, and that even while we're sleeping, our brains are still active. Now, we do know very little bit about how the brain works, and so we probably only know about 10% about how the brain works. So that's a more correct statement, that we only know about how 10% of the brain actually works, especially when it comes to consciousness.
The next one is, I don't know if it's an urban legend or not, but always a warning about swallowing gum, and it sticks with you for 7 years, I think was it, the fashion.
Yeah. So I think this is one that prevents kids from actually swallowing their gum, which is a good idea. It's not true, though. It doesn't stick around in the system. It's not sticky. There's no place for it to get stuck unless you have a huge load of gum and are constantly swallowing it. It tends to pass through our system just the same way that other foods do. It doesn't get absorbed and it doesn't digest the same way, but it will definitely exit the same way.
About cracking knuckles. Any truth to this causing arthritis?
Yeah, so that's another one that's commonly misunderstood, and it sounds like it makes sense, you know, constantly cracking our knuckles. It sounds like it's plausible that it would cause arthritis, but it actually doesn't. They've done studies to show that it doesn't. Now, the way that that sound is made is air actually entering into the synovial fluid, which is the fluid that sits inside of our joints. And so it makes that nice popping sound when the air gets released. Now, over time, it can affect the synovial fluid and damage it, and so you don't want to be cracking your knuckles very frequently, but it won't be causing arthritis.
Something that we hear this phrase all the time, so we assume it's true, is starve a cold, feed a fever. Is it true?
Yes. This is another one. It should actually be feed a cold and feed a fever. The reason is that we need good nutrition, good hydration whenever we have an infection that we're fighting. Our body's natural response to an infection is to create a fever. That shows that our immune system is ramping up, and that can actually dehydrate our tissues and dehydrate our bodies. So it's really important to stay hydrated and also try to keep those nutrients coming in. So definitely feed a fever and feed a cold.
Okay, I have another one. How about the 5-second rule?
So the 5-second rule is one that we've all probably grown up hearing, that you could drop a piece of food on the floor and you got 5 seconds to pop it in your mouth without having to worry about any microorganisms. Now, this is another one that's false. It takes about a second for any sort of microorganisms to tackle and jump onto that food. And so you do want to be careful about picking up something off the ground. Now, when you take into consideration what that piece of food is and what the ground looks like, that obviously plays a role. And things that have moisture and that are wet tend to pick up more contaminants. So something like watermelon, if you drop it on the ground, it's going to pick up everything. And so that's another one that we're going to bust today.
Okay, last but not least, maybe someone's at home watching Living 808 really close to the TV. Is that going to be bad for their eyesight?
So overall, it's not going to damage their eyesight, but it can cause eye strain over time. So it is false that it's going to ruin somebody's eyesight if they're sitting too close to the screen. But over time, with that eye strain, continuous eye strain, that can cause problems. And you've got to wonder, especially when we see kids sitting really close to the TV screen, why are they sitting so close? Is there actually a problem with the eyesight to begin with? So definitely get it checked out.
Well, thank you. As always, fascinating to bust all these myths today. If people want the real deal on medicine and lifestyle, what is your website for them to visit?
My website is drrupie.com, and I'm also on Instagram and Facebook, and that's at dr.rupie.
All right. Dr. Rupie, as always, fascinating. Thank you, and happy holidays.
Thank you. Happy holidays to you.
You know, you've always wondered about so many things. I know your parents have told you this thing, don't go out with cold, wet hair, and 5-second rule. Oh, no, what are you doing?
What you're saying is I'm a little too close to the camera.
Yes, we're seeing your pupil.
Well, I'm really mad, though, because you guys busted my
5-second rule. What's the deal? Now you got to be even quicker, and I'm getting older, and like I'm not as quick. So the 1 second thing is not happening. So it's a 1 second rule.
I know. Just try not to drop it, too, but makes us good fun today.
Thanks a lot.